Hi everyone, I am Dr. Shahan and today in this video I will teach you the difference between gout and pseudo-gout because many students DM me that they don't know the difference between gout and pseudo-gout, but this is an important topic for NEET, PG, FMG and INISET examination. What is the difference between pseudo-gout and gout? Basically, we need to know the points by which we can differentiate between gout and pseudo-gout. By the end of this video, you can differentiate what is gout from a pseudo-gout. What is the crystal that is there in the gout? What is the crystal that is there in the pseudo-gout? What is the birefringence that is there in the gout? What is the birefringence that is there in the pseudo-gout? What is the shape of the crystal of the gout and what is the shape of the crystal of pseudo-gout? You can understand from this video. So watch the video continuously, you can understand what is the difference. Look at the picture. Basically, you can see the picture of a big toe. Generally, when the big toe is shown to you, that actually refers to gout because gout occurs in small joints. This is the first point. Gout occurs in small joint, but pseudo gout occurs in big joints like knee. So here you can see gout. And what is the shape of the crystal of gout? That is needle shaped crystal. Needle shaped crystal of gout. What is the crystal made up of? Uric acid crystal. These are uric acid crystals. So, and this deposit of uric acid in the joint is known as tophi. 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 All these are important questions. Tophi. What is tophi? Deposit of uric acid in the joint. That is in gout, that is known as tophi. What is the crystal shape in gout? That is needle shaped. Which joints are attacked? Generally small joints. Now let us differentiate between the gout and the pseudo-gout. Very important. Gout occurs in middle-aged. Generally middle-aged people they get gout, but pseudo-gout occurs in elderly patients. Pseudo-gout occurs in elderly patients. Which joints are affected? I told you, in gout, you will get the picture of a big toe. They will give the x-ray of a big toe. That is the great toe. So, that is gout. Small joints are affected in gout. Small joints are affected in gout. But in case of pseudo-gout, you will get big joints affected. And which is the most common big joint that is affected in pseudo-gout? That is knee. So pseudo-gout knee, but gout small joint, that is big toe. First point is that is the difference. And what is the crystal that is there in the gout? Monosodium urate crystal. Remember, monosodium urate crystal of gout. Monosodium urate crystal of gout. But in case of pseudo-gout, you get CPPD crystal. What is CPPD crystal in pseudo-gout? That is calcium pyrophosphate dihydrate crystal. Calcium pyrophosphate crystal. So whenever they will give the picture of pyrophosphate crystal, pyrophosphate, P for pyro, P for phosphate and P for pseudo-gout. Remember, pyrophosphate crystal can be found in pseudo-gout. So CPPD, so all the P's are there. CPPD, this is for P, that is pseudo-gout. Remember, pseudo-gout, calcium pyrophosphate dihydrate. But in case of gout, we get the monosodium urate crystal, and these are this is monohydrate, generally monohydrate crystal. So monosodium urate crystal, MSU crystal, that is found in gout. This is the main difference. So what is the crystal that can be found in gout is monosodium urate, but in case of pseudo-gout we get CPPD, calcium pyrophosphate dihydrate, in the pseudo-gout. What is the shape of the crystal in case of the gout and what is the shape of the crystal in case of pseudo-gout? In case of gout, I told you needle-shaped crystals can be found. Needle-shaped crystals are found in the big toe. Needle-shaped crystal, very important. This is gout. So gout, needle-shaped crystal. But in case of the pseudo-gout, you get rhomboid-shaped crystal. rhomboid shaped crystal in pseudo-gout. Rhomboid shaped crystal in pseudo-gout in knee. So rhomboid shaped crystal where will you find? In the knee. In the knee. Remember. And what is the birefringence? Very important, birefringence. So birefringence in case of gout is negative. Negative birefringence can be found in gout. But in case of pseudo gout, it is positive. So you can remember P for positive, P for pseudo gout. P for positive, P for pseudo gout. What is positive? Birefringence. Birefringence. When there is polarized microscopy is done, then you get the birefringence positive in pseudo gout. Positive in pseudo gout. PP. Again PP. That is positive in pseudo gout. But in case of gout, you get negative. In case of gout, birefringence is negative. Very important to differentiate. So, how can we differentiate between the gout and the pseudo-gout? Gout generally occurs in middle-aged person, but pseudo-gout occurs in case of the elderly people. Where does gout occur? Gout occurs in the big toe, that is the small joints. But in case of pseudo-gout, that occurs in case of knee, which occurs in case of the big joint. Crystal which is found in case of the gout is the monosodium urate crystal. But in case of the pseudo gout, we get the CPPD crystal, which is the calcium pyrophosphate dihydrate crystal. Calcium pyrophosphate dihydrate crystal in pseudo gout. What is the shape of the crystal in case of the gout? That is needle shaped crystal. Very important, needle shaped crystal in case of the gout. But in case of pseudo gout, you get rhomboid shaped crystal. And these rhomboid crystals are not needle like pointed. It is blunted. It is blunted rhomboid shaped crystal. Blunted rhomboid shaped crystal. Birefringence. What is the birefringence? How can you remember? I told you P for pseudo gout, P for positive. So pseudo gout is positive in birefringence. Birefringence is positive in pseudo gout. Birefringence is positive in pseudo gout, not in gout. In gout you get negative birefringence. In gout you get negative birefringence. Now look at this picture. Can you see this picture? This picture is showing which joint? First of all, you have to identify which joint. It is a knee joint. Basically it is showing the knee joint, and the crystal that is shown is rhomboid in shape. Can you see the rhomboid shape? Yes, rhomboid shape blunted crystal. It is not needle shaped crystal. And the composition of the crystal is calcium pyrophosphate dihydrate crystal. Calcium pyrophosphate dihydrate crystal. So I have given you 3 clues. Now can you say, is it gout or pseudo gout? 3 important points I told you. One point is knee joint, and second point is rhomboid crystal which are blunted, which is not needle shaped crystal, and the composition of the crystal is calcium pyrophosphate dihydrate crystal, CPPD crystal. This is pseudo gout. Now look at this crystal chart. Very important. Do not forget this crystal chart. In case of gout, you get monosodium urate crystal. In case of gout, you get monosodium urate crystal. Monosodium urate, MSU crystal, monosodium urate crystal, and monohydrate. Generally, monohydrate occurs. So remember, this is gout, monosodium urate crystal. But in case of pseudo gout, I told you P for pseudo gout, P for CPPD. So all the P's are there. CPPD. So CPPD, calcium pyrophosphate, PP. So pyrophosphate crystal. Where is the pyrophosphate crystal? Pseudo gout. P for pyrophosphate, P for pseudo gout. Calcium pyrophosphate crystal dihydrate crystal can be found in pseudo gout. Calcium pyrophosphate crystal can be found in pseudo gout. So remember these 2 crystal, gout monosodium urate, but in case of pseudo gout, calcium pyrophosphate. Now let's discuss about the anti-gout drugs. Look at this picture. This is showing the gout. Now can you identify this picture? If I say the hints, like it occurs in the small joint, it occurs in the big toe of the foot, and the crystal shape is needle shaped crystal. Crystal shape is needle shaped crystal. Then you can understand This is gout. Now let us discuss the drug mechanism of gout. This is very important because it has been discussed. It has been asked in the examination, so you must know. The drug we will discuss is allopurinol. Allopurinol. What does allopurinol do? Allopurinol inhibit the enzyme xanthine oxidase. So it is xanthine oxidase inhibitor. Very important question they always ask. Allopurinol inhibit which enzyme? Allopurinol inhibit xanthine oxidase enzyme. Now let us learn how this the mechanism of action of this drug. Basically purines are there. We get purines from two places, either from the diet or from the nucleic acid we get purines. Now from purines to the things that is produced, that is hypoxanthine. From purines we get hypoxanthine. From hypoxanthine it is converted into xanthine and then converted into uric acid. So from hypoxanthine xanthine is made, and from xanthine plasma uric acid is made. Now this hypoxanthine to xanthine, and from xanthine to uric acid we need xanthine oxidase enzyme. We need xanthine oxidase enzyme. This xanthine oxidase enzyme is inhibited by allopurinol. Xanthine oxidase enzyme is inhibited by allopurinol. This is the mechanism of action of gout drugs. Now look at this picture. Basically it is showing the small joints, and you can see the big toe that is affected, and that is known as podagra. This is also a question, podagra. See, in the when the big toe is affected, it's known as podagra, where gout has occurs, and the needle shaped crystals of monosodium urate has been deposited. So remember, monosodium urate crystals deposited in the big toe known as podagra. Small joints are affected, not only the big toe of the leg, but also you can get these small joints of fingers that also can be affected in case of the gout. So now you can differentiate. At the end of this video you can differentiate between the gout and the pseudo-gout. You know what is the crystal that is there in the gout, what is the crystal that is there in the pseudo-gout, what is the birefringence of gout, and what is the birefringence of the pseudo-gout, and you can understand the difference. This is the end of this video. If you like this video, make a thumbs up, and don't forget to subscribe this channel. I make a lot of hard work to make these videos. Please subscribe this channel. Thank you so much. Have a nice day. Bye bye.